morning. It's Saturday, July 22nd, and this topic this morning is very important to those of us in my age group, and even many, many younger. And I'm talking about the cost of health care. The cost of health care in the United States is much higher, by probably 50% than the next closest nation. We do not have better health care outcomes. And what's more, rising healthcare spending is a key driver of our unsustainable national debt. We have high healthcare costs that also make it harder to respond to public health crises like the COVID-19 pandemic. So let's take a look at the healthcare costs in the United States and figuring out why it's rising and why we're producing such poor results compared to other nations. Now, the results are not bad, but they're not great either. It's reached $4.3 trillion. That averages about $12,900 per person. And the average cost per person in other wealthy countries is half of that. Now, COVID-19 exacerbated some of these issues, but it wasn't the real cause of rising healthcare costs. Relative to the size of the economy, healthcare costs have increased over the past few decades from 5% of the GDP to 18% of the GDP in recent years. That's a hell of a lot of money to spend on healthcare. And when we look at the pricing of healthcare, there are two major things that are happening. There's the cost of healthcare services and the amount of services that are used. And notable factors are our aging population, which is contributing more than we would like, more than we would want to the healthcare pricing situation. The population in the United States at age 65 and over has increased significantly over the past several years. So one of the reasons that we're spending so much money on healthcare is because we're living longer, plain and simple. The number of people over 65 at one time was 13% of the population. Now it's 16% of the population. It's going to keep rising. We're living longer, and that's contributing an awful lot to the healthcare costs. It's only part of the problem. And once you're over 65, you're eligible for Medicare, and that has 65 million people in the program right now, and taking care of them costs us about 3% of our GDP. But that's expected to be 5.5% in the next 30 years or so. And the price of healthcare services is not going down. In fact, healthcare services continue to rise, and they rise faster than almost anything else. So right now, when you talk about goods and services or something, the average rate for most goods and services is 2.5%. That's a growth rate. But medical care has grown at 3.2% per year. So there are several reasons for this increase in medical expenses. First of all, you have new and innovative technology that leads to better and more expensive procedures and products. And then there's a complexity in the U.S. healthcare system that can lead to administrative waste in the insurance and in the provider payment systems. And that is a major, major issue, the insurance and the provider payment systems. And then you have the consolidation of hospitals. So that leads to the lack of competition, and then they can do whatever they want. So you have groups of hospitals that have a monopoly, and that gives them the opportunity to raise prices. So we have to do a lot more research to figure out how we can change these systems and how we have to confirm all the reasons that healthcare costs grow so quickly. And why? Why is healthcare important? Why does healthcare costs matter? The higher it gets, the tougher it is for people to get services. And many people will skip the services if it's going to cost them a lot, and if they feel that they don't need it, so that will lead to more illness and more deaths. It would be wonderful if one could say that the higher healthcare costs are giving us better healthcare service than anybody else. But that is not the case. In fact, much of the expense of healthcare is because of the forms and the insurance companies and the requirements that are necessary to maintain your insurance. So a lot of our healthcare costs are associated with the paperwork that's involved in the system. And there's no standard set of paperwork. And the paperwork is designed to cut down on the amount of people that are going and looking for health care. It's designed to manage the flow of health care. It's not designed to help the consumer. It's designed to protect the corporations and the companies and other organizations that are providing the services. So the paperwork morass is a high expense that's figured into the total cost of your medical bills. The number is astounding. Healthcare experts have estimated that 25% of the total healthcare spending goes to unnecessary, ineffective, overpriced, and wasteful services. That leads many analysts to believe that there are substantial opportunities for the United States to maintain or improve our health outcomes at a lower cost. But I don't believe that's going to happen so fast because healthcare is a business like any other business, and they are not going to reduce their costs if they can get away with it. And let us not forget that in the United States, healthcare is paid for through a number of public and private channels and individual out-of-pocket payments. So how do you shift all of that into some fair, equitable, and reasonably simple payment methodology? So while there are many out there that believe that they could improve the payment methodology associated with medical costs and reduce the paperwork and reduce the amount of people needed to process that paperwork, nobody has sat down and gathered and put together a committee of experts to solve the problem. So for a long time coming, I believe we will be strapped with this medical morass, the payment morass. And there's not much we can do about it because there are so many different pieces involved. It will take a strong leader to gather up the troops and solve the problem. I don't think that person exists right now. So have a great day, and I'll see you in the morning. Bye.